Hey, I've had some really great questions about what I recommend for post-pregnancy issues, or what to do when we're trying to do those supine exercises and just can't get the core, the lower back, and the hips to all coordinate and work together. So first off, when it comes to post-pregnancy issues, I always recommend starting off with some pelvic floor therapy. And since I am here in Kansas City, I typically refer over to St. Luke South or Foundational Concepts because I've had some really good patient success when I refer over there. And then at the same time, when we're coming here to work, we're typically working on tight muscles, continuing that core coordination and core stability, and then just moving from there. But ultimately, it all comes down to adapting to what you have going on. Sometimes, even when we're trying to get the hip and the core to coordinate together, it's just not enough, and we have to switch our tactics and go for a different muscle group. So let's look at that. So a really common issue with post-pregnancy is difficulty getting the diaphragm, the pelvic floor, and the core to all work together and coordinate. But also if you're having difficulty getting the lower back pain or tension, or the hip pain or tension to stop when you're trying to lift your legs from that laying on your back position, sometimes we just have to change up how we're coming at getting that diaphragm to activate. And one of the ways I like to start going at it is if we can't get everything to coordinate control when you're laying on your back, flip over, let that pressure from the ground or table help to stimulate or give some more input for the brain to help that diaphragm activate. So one that I really like to go off to is the 4.5 month prone exercise, where we've got the leg up 45-degree angle, only instead of the arms being up above the head, we're going to have the elbows tucked in the side, having the forehead on the ground or the floor, and we're just going to work on breathing into that abdomen, feeling that pressure go all the way through the pelvic floor, giving it a little bit of pressure, and then breathing out. Now, one of the things I also like to add when we're breathing out is trying to get that hip to stretch. So when you're breathing out, trying to imagine this hip joint stretching out, kind of like you're doing a butterfly stretch. But then once we get a little bit more proficient at utilizing that diaphragm, getting the core and the pelvic floor to coordinate, then we go back onto the back to start progressing in a little bit of a different way.